working in Saudi
Hey
Arabia as a
guys,
medical
welcome
doctor.
back to my channel. I'm your friend Prof. Lizzie, and today I want to tell you about how you can become a doctor working in Saudi Arabia, or how you can apply to get a job as a doctor, to work as a doctor in Saudi Arabia. So, there are different opportunities for doctors in Saudi Arabia, for medical doctors. As a medical doctor, you can join as a resident, or you can join as a specialist, or you can join as a consultant. So, as a resident, all you need to have is your basic medical qualification, which is MBBS. You don't need any additional subspecialty qualification, but you need at least 3 to 5 years experience on the job as a medical doctor. However, for now, for some time, the job opportunities for medical doctors working as residents are limited, are few and far between. The second category is to work as a specialist. Now, the specialist cadre is divided into registrar and senior registrar. A specialist means somebody who has qualified in a given specialty. For a Nigerian, a specialist means somebody who has passed the fellowship of either the Nigerian National Postgraduate Medical College of Nigeria or the West African College of Surgeons in their different specialties. And almost all specialties are accepted except dentistry and public health and to some extent psychiatry. But specialties like general surgery, internal medicine, pediatrics, obstetrics and gynecology, anesthesia, and surgical subspecialties like plastic surgery, ENT, or otorhinolaryngology, or specialties like cardiothoracic or neurosurgery are available, but you must have a fellowship qualification in those specialties to qualify to work as a specialist, either as a registrar or senior registrar. Now, there are some cadre of people that have diploma, maybe in anesthesia or ENT. They are not employable as specialists, but as residents in those specialties. Then the next category is those that will be applying to work as consultants in their different specialties. So to be a consultant or to qualify to be eligible to apply for a job as a consultant, you need to be 5 years, more than 5 years post fellowship qualification or post specialty qualification. So to be a consultant in your field, for example, I'm an anesthesiologist. To be a consultant in anesthesiology, you have to be more than 5 years post fellowship qualification, and you must have impeccable skills, and you must be able to work with high level of proficiency in your field, because the work is a consultant led practice. So these are the three options, the four broad options of eligibility to work as a medical doctor in Saudi Arabia. And now, how do you go about it? Usually there are recruitment firms or agencies that conduct interviews for eligible candidates, and if you're successful, then you have to go through the process of getting the job. You get the visa, and then you begin to get to do your take up your position in Saudi Arabia. Now it's advisable that you do your data flow verification to ease the process of getting to work in Saudi Arabia, because you will be given only 3 months to pass your Saudi Council for Health Sciences, Health Services license for your particular cadre or category. It's called a classification. So you have just 3 months to pass it. Sometimes, in some cases, you are given up to 6 months to attempt and to pass the exam. For the specialists, you have two two attempts at the exam. And for the consultants, you have also 2 attempts at the exam. If you don't pass the classification exam after the second attempt for the consultant, you will have to drop to a lower level if you will continue your job. So now the terms are basically the same, and you need to have adequate proficiency in English language, and a good knowledge of the Arabic language is also helpful, although it's not mandatory. But things are done, the language is Arabic, but most people in the health sector understand and speak English, and so you might be able to have people who will translate for you if in the course of your work. And as regards the work-life balance, is fairly okay. You need to know your work very well. You need to be very efficient and effective. You need to communicate very well, and you need to operate with high standard of professionalism. And so that's it for now, what I can tell you about working as a doctor in Saudi Arabia. I'm going to be giving you tidbits about other countries working as a doctor or a nurse in due course in my series of working and work and job opportunities across the world. Thank you very much for listening. I would like you to comment and what do you think about what I've told you. If there are other contents that you would like me to talk about, please drop it in the comment section. And if there are any other information you would like me to share with you on my mentoring platform, also do let me know. I run a mentoring group mostly for anesthetists, anesthesiologists, and general doctors. If there are other content that you like me to talk about, do let me know. And I'll see you in my next video. Please subscribe to my channel, like, share on all platforms. Share if this is important to you, or you find this content useful and beneficial to you. Share. You can help a brother or help a sister. And I'll see you in my next video. Thanks a lot for listening. Bye for now. Ciao.